Hi everyone, I'm Ningbian. Today I will present Chapter 10, Post-Polio Syndrome. Table of Contents. There are overview and history, etiology, diagnosis, manifestations, treatment, prognosis, contraindications, management plan, and conclusion. So first, overview and history. What is poliomyelitis? It's also named simply polio. It's an acute infectious viral condition that primarily affects the brainstem, spinal cord, and the neuromuscular system. And what is the post-polio syndrome? It's a non-contiguous neurological disorder that produces a variety of manifestations in individuals. The cause of post-polio syndrome is unknown. History. It was prevalent in the United States in the first half of the 20th century. In the late 1970s, many people who had experienced initial polio infections decades earlier began to report unexpected manifestations, ranging in severity from mild to severe disabling. In the early 1980s, the term post-polio syndrome was coined to describe this new phenomenon. Etiology. The poliovirus causes polio. The brainstem, spinal cord, and the neuromuscular system can all be affected. Nerve cells or motor neurons destroyed by the poliovirus are located in the anterior horn of the spinal cord. As neurons are affected, muscle cells lose their ability to contract, leading to paralysis. How does polio spread? The virus enters the body when contaminated water or food is ingested, or when hands that has been contaminated with the virus touch the mouth. Diagnosis. General breath evaluation routine, laboratory test, electromyographic studies, a graphic record of the contraction of a muscle as a result of electrical stimulation, nerve conduction examination, magnetic resonance. There are 3 tips. The first identification of post-polio syndrome involves ruling out or eliminating other conditions that may be responsible for the new manifestations. The second, manifestations of post-polio syndrome may be difficult to distinguish with these associated with other degenerative conditions of muscles and joints, such as osteoarthritis or osteoporosis. The third, magnetic resonance imaging may be used to exclude other conditions of the spine that could cause similar manifestations. Common manifestations include slowly progressive muscle weakness, generalized and muscular fatigue, gradual decrease in muscle size, and muscle pain and joint pain, increasing skeletal changes such as curvature of the spine, respiratory muscle weakness, difficulties swallowing. Treatment. Because the cause of post-polio syndrome is unknown, so there not only one way to treat it. A thorough physical examination. Physiotherapy. Use assistive devices, for example, wheelchairs. Use non-invasive positive pressures ventilations when patients with breathing difficulty at night, and use breaths to reduce muscle and joint pain and weight loss to reducing fatigue and stress on muscles and joints, as well as preventing breathing difficulties. Prognosis. There is no specific intervention that can alter the course of the post-polio syndrome. Post-polio syndrome is progressive, and the symptoms get worse and worse, but the process has been slow. Interventions are targeted to control the manifestations of post-polio syndrome to help patients maintain their functional status and independence for as long as possible. Post-polio syndrome is rarely life-threatening. Contraindications. Don't ingest contaminated water and food, or touch a mouth with hands contaminated with the virus. Otherwise, the virus can enter the body. Intense exercise or excessive fatigue can cause muscle and joint weakness and pain to get worse and worse. It can even cause loss of muscle tissue and difficulty breathing or swallowing. Management plan. Maintain good hygiene. Establish a healthy lifestyle that includes proper nutrition and adequate rest. Follow the physical therapist's guidance on the correct exercise regimen to avoid overuse and excessive fatigue. Because people with post-polio syndrome are more susceptible to infectious diseases. Pneumonia and flu vaccination are often recommended. Conclusion. Polio vaccination is the most effective way to prevent polio. The cause of post-polio syndrome is unknown, and there is no single treatment for the virus signs and symptoms. The goal of treatment is to manage the patient's symptoms and help them be as comfortable and independent as possible. Post-polio syndrome is progressive, meaning the symptoms get worse and worse. With proper exercise, strength and function can be improved and the rate of loss of ability can be slowed. Good hygiene, including proper nutrition and adequate rest, is important to maintain optimal functioning. This is my presentation. Thank you.